Good morning, everyone. I'm going to talk today about the Israeli, wait a second, I don't see myself. Is it okay?
Yes.
I'm going to talk today about the Israeli LSD experience, lysosomal storage disorders patients' experience with COVID-19. I have to say that when I was asked first to give a talk, my first thought was that, well, I don't really have anything to say. But then I managed to show a little bit what happened here, which is not much, as you will see. So these are my disclosures. And what I mean to show today is actually a little bit about the background of what's been going on with COVID-19 in Israel. Then a little bit about the patients affected by COVID-19 and adherence of the patients to parenteral treatments or others, and the influence of COVID-19 on the situation on the lysosomal storage disorder patients. So if we look as a background about what was going on in Israel since the end of February, which is when it started to rise in Israel, you see that up to about up to about the middle of June, the absolute number of patients got to be about 20,000. And the number are still rising right now because we are starting the second wave right now. And here you can see, since the people talking before me were from Italy and Germany, I decided to show what's going on in Israel compared to other countries, including the USA, of course. And I started with the number of affected people per 1 million. And as you can see, Israel compared to others is pretty low, which means we have less than 2,000 per. Since we have 9 million, it's it's around 2,000 people per 1 million. And I think that explains some of the differences between other countries and Israel regarding the COVID-19 influence. Again, if you look at the number of deaths are pretty low, and it still goes on even now that we have a second wave. And the total number of fatalities around the 16th of June or the middle of June was 303 fatalities. So how come it looks much better than other countries around the world? I think the Israeli preparedness for COVID-19 was different, or that's the way we see it. So there was flights were stopped really very early at the beginning of March. Most of the flights stopped around the beginning of March or beginning to middle of March. There was preparation of isolated COVID-19 specific wards in every hospital, and every traveler arriving from outside of Israel to Israel had to be in isolation for 2 weeks, beginning at the beginning of March, actually, or even before the beginning of March, whether at home or in a specialized hotel or unit, which means they were kind of quarantined even then. We also started a very early and very prolonged quarantine at the middle of March and until the end of April. Also, very early we started with large numbers of COVID-19 screening tests that still continues as we speak, and which leads us to the fact that no lysosomal storage disorder patient died due to COVID-19, and no patient was even admitted due to COVID-19. The only, from last week, we had 2 Sanfilippo A patients that were affected with a mild flu-like disease, which didn't necessitate any other treatments, any other drugs. What about the adherence to treatment protocols? So most patients in Israel have continued their ERT treatment as recommended, and as I'll show you in the next few slides. However, since they were really afraid and stressed about the COVID-19, they didn't go to other treatments such as physiotherapy or a physical therapist during the pandemic. And if we look at different treatable diseases, you can see if we talk about Morquio disease, MPS IVA, you see we have around 28 patients in whole Israel. Pre-COVID-19, 21% were home treated, and 2 patients, which is 7%, switched to home treatment during the pandemic. However, none of our patients had missed any infusion during the period of April-May, which are the main month of the pandemic. One of the sad things is that actually in Israel, only half of the patients are treated all the time because vimizim is still not in the Israeli health basket. If we go to Maroteaux-Lamy syndrome, then we only have 4 patients in Israel. 2 patients are not treated even before the pandemic because they had anaphylactic reactions, severe anaphylactic reactions. And 1 patient who switched later to home treatment actually missed about a month of treatment because he couldn't get to the hospital during the time of the pandemic. So it took him time to switch to home treatment, and during that time he wasn't treated. When we asked the patients how they felt during the time, no reported mood changes were reported by the patients or their parents. We have about 50 diagnosed Fabry patients in Israel, and compared to the time period before the pandemic, there was no change in treatment adherence recorded or reported. Also, as known, and Fabry patients tend to have different mood changes and even psychiatric issues, but there was no reported increase in suicide attempts or mood changes compared to the previous time before the pandemic. We have 13 Hunter disease patients. 46 of them were home treated before the COVID-19, and 7.5% did not get infusion at least 1 month during the pandemic due to fear or stress of coming to the hospital. And 15%, which is 2 patients, actually got only half of the treatment. 23% of patients switched to home treatment during the time of the pandemic. We have 23 patients of Pompe disease. Most of them, as you can see, got treatment with no interruption. 1 patient didn't get infusion per month because of he couldn't get to the hospital, and 2 more had interruptions of half a month here, half a month there, because they were afraid to get to the hospital. We have 14 diagnosed patients with Niemann-Pick C1. 3 of them are under clinical trial protocol, which means they're supposed to come to the hospital every 2 weeks to get the cyclodextrin. 2 of the 3 missed each one infusion during the COVID-19 period, since they were afraid to get to the hospital. Afterwards, they came as usual. What was interesting is that the different parents said that the patients who were higher functioning actually had a good time staying at home under the quarantine with their parents, and even had advanced in their development during that time, compared to other patients who were lower functioning, who actually had deteriorated being out of their education system. Regarding Sanfilippo A patients, these are answers from about 8 patients' parents, and they reported that that the kids who were at home all the time couldn't get out of the house because there was a quarantine, actually had more anxiety, had irritability issues. They were more aggressive, and they needed more drugs to be more quiet and relaxed. Thank you for listening.